They can be flat, they can be raised, they can sort of be on a stalk, they can be in the shape of a mushroom or shape of a cauliflower. They come in all sorts of shapes and sizes. Guys, we are talking about colon polyps today. This is an important topic because, by the way, many colon polyps are benign. They're perfectly healthy, perfectly fine, but some of them are already cancerous or may become cancerous. This is why we care about colon polyps, why you should know about them. I'm going to tell you what you need to know. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. First of all, you're wondering, you're like, what in the world is a colon polyp? What is a polyp? Well, a polyp is an extra piece of tissue that is growing, basically growing along the lining of the large intestine or the colon or the rectum. And this is the thing, I told you, they can be in all sorts of shapes and sizes, flat, round, raised, on a stalk, cauliflower, mushroom, you name it. About 20 to 30% of the population will have colon polyps. And like I said, the big thing here is many of them are healthy and fine, but some of them are already cancerous. Some of them might become cancerous. This is why we care. You're probably wondering, well, how would I know if I had colon polyps? Well, the truth of the matter is most people don't know they have them. I have family members with colon polyps. I've never had a colonoscopy, so I don't know if I have them or not, but you know, and sneak peek to what I'm about to talk about. But this is the thing. Most people who have them don't even know that they have colon polyps. So don't expect that you would feel something or know something. Yes, sometimes there can be bleeding or what have you. But look, anytime there is bleeding from down below, you should always be getting checked out, just as an FYI, okay? But know that most people don't even know that they have colon polyps. This is the thing. How would we tell that you have them? Well, I'd say colonoscopy is probably the most common way that people find out that they have colon polyps, because they're actually able to be seen when the doctor does a colonoscopy. Now, there are other ways and other tests that doctors can do that can see the polyps. But this is the thing. When you have colon polyps, we often want to remove them, right? We want to know what type of polyp it is. We want to know what it's made of. We want to know if it's healthy. We want to know if it's precancerous. We want to know if it's cancerous already. So oftentimes we remove them. You say, well, how do we do that? Well, colonoscopy will get rid of them. But sometimes we have to use other modalities as well, maybe surgery or something else. It just depends. It depends on how many you got, the size they are, who you are, all this good stuff. You know, I always say, I'm here to give you the sort of the nuts and bolts, the 50,000 foot view. You got to talk to your doctor about this, follow your doctor's advice, but I want you to know about colon polyps and also know why they're important. So just know that you may not know if you have them or not. Sorry for the background noise. It's car traffic. But if you have them, we can often detect them on colonoscopy and other modalities, and then they can be removed by colonoscopy, sometimes other ways as well. And that's very, very, very important. You know, oftentimes removing these colon polyps is essentially preventing colon cancer. So that's important. A few risk factors, okay? So you're probably saying, well, who's most likely to get these colon polyps? What do I need to worry? People who are most at risk are people over 50, people who've had polyps before. If you've had them before, you're probably more likely to get them again, or at least more likely than someone who's never had them, at least. Somebody with a family history, or rather somebody in their family who has them, or somebody who has a family history of colon cancer. But there are also other lifestyle factors that may contribute to the development of colon polyps. Smoking, obesity, alcohol intake, increased fatty foods intake, increased red meat intake, and decreased fiber intake in the diet. Those are things that could also contribute to polyp formation as well. So this is the thing. The most important thing for you to know is that colon polyps really are a thing. It's another reason why colon cancer screening is so important, and making sure that you're getting your colonoscopies or any tests that your doctors recommend. Know that if you have a family history of colon polyps, or you have a history yourself, you got to make sure you stay on top of your screenings. You've got to talk with your doctor about how often to be screened, either by colonoscopy or other tests, and just make sure you understand the importance of colon polyps. Once again, many of them are just fine, but some of them could be cancer or may turn into cancer. It's why we care. So as I always say, make sure you take care of yourself. Knowing is half the battle, as I always think. Guys, I'm Dr. Jen Caudle. Let me know if this was helpful, and let me know if you've already been screened with a colonoscopy or colon cancer screening in the comments, or if you know you have colon polyps. Feel free to share if you want to, or if you have any tips for others. Guys, I'm Dr. Jen Caudle. If you've not subscribed to my channel and clicked the little bell for updates, I invite you to do so. Guys, I'm Dr. Jen. I'll see you soon.